I want you to take a second and just imagine the one place you probably dread going to the most.
Oh, yeah, we all have one.
Right. And you know the feeling I'm talking about. Your palms get a little clammy, your chest tightens up. You start doing that mental math about the cancellation fee.
Yep, calculating if it's worth the hit to your wallet.
Exactly. Maybe you even trying to convince yourself that the throbbing pain in your jaw is just, I don't know, seasonal allergies or something.
Which it never is.
Oh, I have absolutely done that, though. I mean, for a massive portion of the population, that terrifying place is the dentist's chair.
Without a doubt.
You are, leaning back, staring up at those blinding clinical lights, just anticipating that high-pitched, whining squeal of the drill.
Just hearing you describe it makes my teeth hurt a little bit, honestly.
Right. And you're breathing in that hyper-sterile smell, like clove oil and latex. It's just a deeply universal anxiety.
It really is.
But today, our mission for this deep dive is to explore how a truly radical combination of, high-tech virtual reality and surprisingly low-tech psychology is stepping in to completely eliminate traditional dental fear.
Yeah, and it really is a complete teardown of the traditional experience.
How so?
Well, we are moving away from a model of just, white-knuckling your way through a checkup.
Right.
And they're replacing it with an environment where the nervous system is actually the primary focus of the treatment.
Wow.
Yeah, all before a single instrument is even picked up.
Okay, let's unpack this, because looking at our sources today, we are diving into modern relaxation techniques for dental anxiety.
Right.
And specifically, we're looking through the lens of practices like My Gentle Dentist, which it isn't just a clinic, it's like an entire philosophy.
It's a total paradigm shift.
Yeah, they've built their whole brand on this idea of stress-free, compassionate care for nervous patients.
Right.
They are essentially operating on the premise of, we know you hate being here, so we are going to change literally everything about what it means to be here.
And to appreciate the scale of that solution, we really have to understand the actual severity of the problem first.
Right, because it's not just a minor fear for a lot of people.
Yeah, not at all. We aren't talking about people just being mildly inconvenienced. We are looking at data showing millions of people who actively avoid the dentist for years.
Years.
Sometimes decades, just due to very real, visceral psychological barriers.
That's intense.
It is. I mean,
Yeah.
you have patients carrying past trauma from painful childhood visits.
Oh, totally. The stuff that sticks with you.
Exactly. You have trypanophobia, which is the severe irrational fear of medical needles.
Yeah.
And then you have those intense sensory triggers you just mentioned in the intro.
The smells and the sounds.
Right. The highly specific, sharp antiseptic smell of a dental clinic. The intense vibration of the equipment resonating in your skull. Well, to the brain's threat detection center, those aren't just annoyances, they are blaring alarms.
And those alarms create what our sources call the avoidance cycle.
Yes, the dreaded avoidance cycle.
Which tracks logically, honestly. You are terrified, so you postpone your visit.
Naturally.
You put it on the calendar for next month, then you cancel it again when the time comes.
Yep, you just keep pushing it down the road.
Right. And a tiny microscopic cavity that could have been fixed in 20 minutes with zero fuss turns into a throbbing, deeply infected tooth.
And now you have a real problem.
Exactly.
Right.
So now you finally have to go in, but it's an emergency.
Which means it's painful, it's highly invasive, it's expensive.
And the entire grueling process just reinforces to your brain that the dentist is, in fact, a terrible, painful place.
Exactly. It completely validates the fear.
It's like ignoring a flashing check engine light purely because you're terrified of the mechanic.
Oh, that's a great way to put it.
Like, the car is still going to break down, but now, instead of a quick oil change, the engine is actively smoking on the side of the highway, and it's going to be a total catastrophe.
Right. The avoidance basically guarantees the catastrophe.
Yeah.
But what's fascinating here is the paradigm shift that modern dentistry is making in response to that exact cycle.
How so?
Well, it requires looking at a bit of history. Historically, dentistry was born out of a very mechanical, almost utilitarian tradition.
Like the local barber pulling teeth.
Exactly. Hundreds of years ago, the local barber was often the guy doing extractions.
Ayooks.
Right. And as the profession modernized, it became intensely hyper-focused on efficiency and mechanics.
Fix the tooth, fill the cavity.
Exactly. Extract the root. The mouth was treated almost like an assembly line.
Wow.
And the intense anxiety of the human attached to that mouth was largely viewed as an inconvenience, something to be managed quickly or just ignored entirely.
Just power through it, basically.
Right. But the new standard of care flips that entirely.
No.
It operates on the medical principle that you are treating the person, not just the teeth.
Which makes so much sense.
It does. You have to actively address the sympathetic nervous system first. If the patient does not feel entirely implicitly safe, no clinical work should begin.
I mean, knowing that the medical community is actively prioritizing the fear is a massive relief just to hear out loud.
It is a big step.
But, validating the fear is one thing. Actually stopping those physical threat signals in a brightly lit medical room is another.
That's the tricky part.
Right. If the core problem is sensory overload, the shrill sounds, the chemical smells, the intense spotlight on your face, how do you actually isolate the brain when a patient's mouth is literally propped open?
Well, if you can't change the physical reality of what needs to happen inside the mouth, you have to completely alter the physical reality the brain is perceiving everywhere else.
Okay.
And this is where we see the introduction of highly immersive technology.
Yeah, and the sources outline a scenario that sounds incredibly futuristic.
It really does.
They sit down in the chair, but instead of staring at that awful popcorn ceiling or the glaring examination light, they put a lightweight VR headset on you.
Right.
And they cover your ears with high-end noise-canceling headphones. So suddenly, you aren't in a clinic anymore.
You're gone.
Yeah. You are completely immersed in a 360-degree environment. You're walking along a quiet Australian beach, watching the waves crash.
Or floating through a vibrant coral reef.
Exactly. Or sitting in a perfectly peaceful, sunlit forest. And the data shows this environment actively lowers heart rates and reduces cortisol, the primary stress hormone, right there in the chair.
It produces a measurable physiological drop in the body's fight or flight response.
That is wild.
And the design of these VR environments is incredibly intentional, by the way.
Really? How so?
Well, they utilize spatial audio, meaning the sound of the ocean waves or the forest birds moves around your head in three-dimensional space.
Oh, like surround sound for your brain.
Exactly. This effectively tricks the inner ear and the brain's spatial processing centers into believing you have actually relocated.
Wow.
You aren't just distracting the patient, you are biochemically altering their state of panic.
Okay, but here's where it gets really interesting, though, and I want to push back on the limits of this technology.
All right, go for it.
As amazing as a 3D coral reef sounds, if I'm sitting in my living room watching a highly immersive IMAX movie on a VR headset and I stub my toe on the coffee table,
Yeah.
I am still going to feel the pain of stubbing my toe.
Sure.
My toe is still attached to my body. So how does watching waves crash on a beach actually trick the physical brain into ignoring the sensation of someone literally drilling into a molar?
That is the million-dollar question.
Yeah.
And it comes down to a fundamental concept in neurology known as the gate control theory of pain.
Gate control theory, okay.
Yeah. To put it simply, your brain and your spinal cord have a limited bandwidth for processing incoming sensory stimuli.
Bandwidth like an internet connection?
Exactly like a home internet connection. If you are downloading a massive 4K movie file, everything else on the network slows to a crawl.
Right, because the bandwidth is fully occupied.
Exactly. The nervous system only has so much processing power at any given millisecond.
So they're essentially buffering the pain.
Pretty much. Going deeper into the anatomy, pain and anxiety signals have to travel through nerve gates located in the dorsal horn of the spinal cord to reach the brain.
Okay, gates in the spinal cord, got it.
Now, if the brain is relatively idle, say just staring at a blank ceiling, those pain signals have a wide open highway.
They just cruise right in?
Yep. They rush right in via these slow-moving nerve fibers called C fibers, and you feel every scrape, every vibration, and every ounce of panic.
Ugh, the worst.
But if you suddenly flood the brain with highly engaging, complex, and pleasant visual and auditory data like navigating a 360-degree environment,
Okay.
you are engaging a completely different set of nerve pathways called a beta fibers.
A beta fibers.
All right, these fibers process touch, vibration, and intense visual or auditory input. And crucially, a beta fibers are larger and much faster than the pain fibers.
So they literally outrun the pain signals to the spinal cord.
They beat the pain signals to the gate, exactly. And because they demand so much of the brain's bandwidth to process, they effectively close the gate on the slower pain signals.
That is incredible.
There literally is not enough processing power left for the brain to fully register the mild discomfort of the dental work.
So it's not just a distraction.
No, it's not that the brain is just distracted by a pretty picture. It is biologically preoccupied. It creates a neurological traffic jam.
A neurological traffic jam. I love that.
The brain prioritizes the overwhelming, fast-moving sensory input of the VR, leaving the physical sensations in the mouth muffled, distant, and largely ignored.
Okay, but bandwidth only gets you so far, though.
What do you mean?
Because even if I am visually immersed in a coral reef, and even if my nerve gates are jammed up with sensory data, my lizard brain still knows I am lying backward. I'm tilted at a severe angle, with my mouth forced open. I am fundamentally trapped in a vulnerable physical position.
You definitely are.
So how does a virtual environment solve a purely biological feeling of captivity?
You've hit on a really important point there. The most sophisticated VR headset in the world won't work if the person wearing it feels like a hostage.
Exactly.
The sensory distraction only handles the sights and the sounds. It does not address the psychological need for autonomy.
Right.
This is why practices operating under this modern, gentle philosophy utilize what they call a comfort menu. VR is just one layer of a highly orchestrated system.
Yeah, and looking at this comfort menu, it really acts as a bridge between high-tech neurology and basic chemistry.
It really does.
First up, they use happy gas, which is nitrous oxide. And our sources emphasize this is a very safe, mild sedative that you just breathe through a small nose piece.
Very common, very safe.
Yeah, and it doesn't knock you out. It just gives you this incredibly warm, euphoric feeling.
Like a nice, relaxing buzz.
Right. And the best part is that it wears off in mere minutes once they stop administering it, meaning you can literally drive yourself home safely right after the appointment.
Which is super convenient.
It is. But what is it actually doing to the brain to create that euphoria?
Well, nitrous oxide is fascinating because it works on multiple fronts simultaneously. When inhaled, it interacts with receptors in the brain to trigger the release of endogenous opioids and dopamine.
Dopamine.
Yeah, basically the body's natural feel-good chemicals. And at the same time, it enhances the activity of GABA receptors, which are responsible for inhibiting anxiety and fear pathways.
So it's turning up the good feelings and turning down the fear at the exact same time?
Exactly. It effectively takes the sharp edge off the fight-or-flight response. It melts away that rigid muscular tension in the neck and shoulders that patients don't even realize they are holding.
You just kind of sink into the chair.
Exactly. It changes your emotional reaction to the reality of the room.
Wow. And then you have the sensory management regarding the needles themselves, which directly addresses that trypanophobia, the fear of needles that keeps so many people away.
This is a huge one.
Right, because instead of just going straight in with a local anesthetic injection, the comfort menu includes using highly effective numbing gels on the gums first.
They numb the area before they numb the area.
Yes. They've essentially engineered a way to make the process of getting the painkiller completely painless.
Which is crucial, because if the first thing that happens in the chair is a sharp pinch, the trust is instantly broken.
Right, the adrenaline spikes.
Exactly. And the VR won't be able to pull you back out of that panic. The foundational rule of this entire approach is that at no point should the patient experience a spike in pain.
Because pain confirms the bias.
Yes. Pain confirms the brain's pre-existing bias that the dentist is a dangerous place.
Okay, so I see the high-tech VR tricking the spinal cord, and the pharmacological aids like dopamine-triggering gas and advanced topical gels managing the physical sensations. But then the sources highlight something incredibly low-tech as being just as critical as all the science we just discussed.
This might be my favorite part.
It's called the stop signal protocol. It's literally just a simple agreement established before anyone touches you. If the patient raises their left hand, the dentist immediately stops all work.
Pulls the tools back, hands out, done.
Just like that.
Yeah.
Now, I have to admit, as someone who hates the dentist, my first instinct would be to test that signal immediately.
Oh, I guarantee you would.
Like 3 seconds in, just to see if they actually listen.
And they would. They have to.
But why is a simple hand raise carrying the same weight as advanced biochemistry?
To understand the power of that simple hand raise, we have to look at the psychology of anticipatory anxiety.
Anticipatory anxiety.
Think about sitting in the waiting room.
Yeah.
The procedure hasn't started. Nothing hurts yet, but your heart is pounding against your ribs.
Just waiting for the bad thing to happen.
Right. The fear isn't coming from pain. It is coming from the anticipation of a total loss of control.
Oh, wow.
You are anticipating being put in a highly vulnerable position where you cannot speak, you cannot easily move, and you cannot stop what is happening to you.
That makes so much sense.
A lack of control is the absolute root of panic in any medical setting.
It's the feeling of being strapped into a roller coaster that has already started clicking up the tracks. You can't get off no matter how much you want to.
Exactly. But by instituting a strict, non-negotiable stop signal, You are taking the power dynamic of the room and completely inverting it.
Giving it back to the patient.
Exactly.
Hmm.
You are taking the control away from the doctor and handing it entirely to the patient. It acts as a psychological safety net.
So just knowing you have the power to stop it makes you less scared.
Right. Knowing that you possess an absolute kill switch that simply raising a finger commands the entire room to stop it drastically lowers the anticipatory anxiety.
Hmm.
You don't have to panic about being trapped because the environment has been explicitly designed to prove you are not trapped.
Like, if you know you have the power to stop the roller coaster at any time, you don't actually mind the ride.
That's exactly it.
It's not about actually needing to use the stop signal. It's the profound psychological comfort of knowing that you have it in your back pocket.
And what's amazing is that the vast majority of nervous patients who are given the stop signal rarely ever use it.
Really? They just let the dentist work.
Yep. The mere presence of the boundary is the cure for the anxiety. When you combine that profound psychological autonomy with the chemical relaxation of the nitrous oxide and the sensory hijack of the virtual reality.
We're just hitting the problem from every angle.
Exactly. You have effectively dismantled every single pillar that holds up dental fear.
Which brings me to the long-term data, because I'm looking at this data from these gentle dentistry practices, and it initially seems somewhat counterintuitive.
How so?
Well, they go to great lengths to make the office feel like a spa so people aren't scared. But the data shows that patients who experience this are actually getting fewer cavities and requiring less major dental work over a 5 or 10-year period. Is that purely because they just aren't terrified to book their standard 6-month cleanings anymore? Or is something deeper happening? So what does this all mean for the patient's actual physiology long term?
Well, if we connect this to the bigger picture, it goes much deeper than just better calendar management.
Yeah, okay.
It is about the neuroplasticity of trauma.
Neuroplasticity of trauma.
Yeah. Trauma, fundamentally, is a learned neural response. For decades, a fearful patient's amygdala, which is the brain's fear center, has been hardwired to associate the dental chair with pain, helplessness, and threat.
Right. Dentist equals danger.
Exactly. But the brain is plastic.
Yeah.
It can unlearn just as it learns. And this process is called extinction learning.
So having just one positive, pain-free visit where you feel entirely in control forces the brain to update its internal software.
That's a perfect analogy. When the amygdala prepares for a massive threat, and that threat never arrives.
Because of the VR and the stop signal and everything.
Right. And instead, you experience a warm euphoria, a pleasant visual stroll, and complete bodily autonomy. Well, synaptic pruning occurs.
Synaptic pruning.
Yeah, the old fear-based neural pathways physically weaken, and a new, safe neural pathway is formed.
That is amazing.
You are giving the nervous system a completely new data point to overwrite the old, scary memories. And the cascading effect of that neurological update is monumental for physical health.
Because suddenly the avoidance cycle we talked about at the beginning is entirely broken.
Exactly. Broken completely.
You aren't waiting for the check engine light to start flashing and the engine to start smoking.
Right.
You are just taking the car in for its scheduled maintenance because you actually like the mechanic.
Yes. You've shifted your entire behavioral pattern. Patients who undergo this type of care begin returning for routine checkups without hesitation. They get their cleanings.
They catch the small stuff.
Exactly. They catch minor, microscopic decay before it ever has the chance to require a root canal. They are shifting from a life of reactive, panicked, emergency care, which is driven entirely by the fear avoidance cycle,
Right.
to a life of proactive, preventative wellness. Practices pioneering this philosophy are proving that prioritizing emotional comfort right alongside physical health isn't just some luxury spa treatment.
It's actually medicine.
It is a fundamental medical necessity for long-term health outcomes.
It completely reframes the whole concept of healthcare. It's not just, open wide, bear the pain and let us fix you.
No.
It's like, let us actively make you feel safe down to a neurological level so that you actually want to take care of yourself.
Beautifully said.
Well, let's do a quick recap of the territory we've covered today.
Sounds good.
We started with the very real dread of the chair and how sensory triggers create a dangerous avoidance cycle.
The flashing check engine light.
Exactly. And we learned how virtual reality leverages the gate control theory, sending fast-moving visual data to literally close the nerve gates in your spinal cord, creating a traffic jam that blocks pain signals from ever reaching your conscious mind.
A total sensory hijack.
Then we unpacked the comfort menu, Understanding how nitrous oxide alters brain chemistry to inhibit anxiety, and how numbing the gums prior to an injection removes the initial spike of pain.
Preventing the panic before it starts.
And critically, we learned how a simple low-tech stop signal gives you back your autonomy, unlearning decades of trauma in the amygdala and setting you up for a lifetime of proactive health. It is a brilliant, multi-layered transformation of an experience most of us used to dread.
It truly is a masterclass in behavioral design.
Yeah.
And it leaves us with something quite profound to consider moving forward.
Oh, what's that?
Well, if a simple hand signal and a digital stroll down an Australian beach can actually rewire decades of deep-seated trauma by hacking our sensory bandwidth and restoring our sense of control, it raises a fascinating question. What other deep-seated fears or avoided tasks in your life could you conquer using this exact same blueprint of immersive technology and structured empathy?
Wow, that is something to think about. Well, a huge thank you to you for joining us on this deep dive. We'll see you next